live on YouTube. So we have an archive of the meetings that you can go back to anytime. And about now we are live. So I'm Harvey Ferdman. I'm the chair of president of the Maryland Heights Township Democratic Club. And we meet jointly with the Creve Coeur Democratic Club. And Florence Pullen is the president of that club. And I'd like to introduce Florence and turn the floor over to her to introduce someone who's going to lead us in the Pledge of Allegiance. And then I have a quick poll to run. And then Florence will introduce our speaker.
Good salad.
So Florence, if you would.
Raspberry dressing. That's probably why. Hello? Can you all hear me?
You're good.
Good.
Yes.
Okay, well, we're going to have the Pledge of Allegiance led to us by Councilwoman Nicole Greer of Creve Coeur.
Okay. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much,
Thank you, Nicole.
You're welcome.
And I'd like to just do, well, first off, does anyone have any brief announcements they'd like to make?
Well, Harvey, I would like to, if no one else has one, I would like to do mine before the presentation tonight for Creve Coeur. And that is regarding our township dues. Normally, we send a letter out to our members or people who will become members in October and November and December, and somewhere around, I guess, the 1st of November, you will receive a letter explaining our dues to you, and we hope that you will join our club back again or renew your membership. And the next announcement I would like to make is, been president for quite a while for Creve Coeur Township, and we will have an election in November, and this will be separate from our meeting that we have tonight, so that we can get members, elect officers of the Creve Coeur Township Democratic Club. So if you're interested in running, send your information. My email is at the bottom of the flyer that you received, fterrypullen@aol.com. Please send your information to that email, and I'll be sure to have someone to put your name on the list so we can discuss this later. Thank you.
Thank you. And the same for the Maryland Heights Township Club. It's time to have elections, and anyone who's interested in serving, please let me know. Also, if you're not sure what township you're in, if you got the MailChimp announcement from the Maryland Heights Township about this meeting, there's a link towards the bottom of the flyer that lets you go onto the Secretary of State's site, put in your home address, and it will tell you all you ever wanted to know about your voting districts, your township, etc. Some of these things are going to move with the census, but for now, we should go ahead with what we have. Okay, and with that, I'd like to ask elected officials to identify and introduce themselves, and in particular, I noticed Tracy McCreary is on, and Tracy, I do believe that you have declared to run for an additional office besides the one you hold.
That's correct, Harvey. Thank you for letting me have a chance to say hi to folks. I'm State Representative Tracy McCreary. I'm a super senior in the Missouri House of Representatives right now. I am running for the Missouri State Senate for Jill Shoup's spot in the Missouri Senate, and I do have Senator Jill Shoup's full support and endorsement. For those of you that are political junkies, I think you probably wouldn't be on this call if you weren't. This is one of the few competitive seats in the state of Missouri, so we're doing everything we can to make sure we protect Senator Jill Shoup's seat. So, and the only call to action I have tonight is my campaign kickoff is at Senator Shoup's home on Thursday night, and I could use a couple of volunteers if anybody is interested. It's going to be an outdoor event. Thank you.
Very nice. Thank you. Nicole?
Yes, you all already said, I was Councilwoman Nicole Greer from the city of Creve Coeur. In addition to that, as you know, Harvey, I'm also Commissioner Nicole Greer. So I am serving on the State Senate Commission, which is going, based on the census, which was mentioned, is going to determine what our districts will look like going forward. Well, at least for the next 10 years. I do want to let you all know that the State Senate Commission will have its first public hearing in St. Louis on October 16th. I believe the time is 10 a.m. And I think we have a location, but I'm hesitant to say where in case that changes. So before I put the location out there, I want to be 100% sure. It is important that you show up for these public hearings. The Republicans have already submitted a map. You know, they're gerrymandering. The district that Senator in the future, Senator McCreary, currently Representative McCreary is running for, is one of their targets. They're trying to, redraw that district to where the Democrats won't have that anymore. So, and I'm sure that won't be the only one. That's just one I know because I happen to live in that district. So again, please mark your calendars for October 16th. And plan on showing up for the public hearing. The Democrats have been trying to push for accessibility to the public hearings, like by having them on the weekends and on the evenings, because the working class can't show up during the times that they're trying to schedule them during the day. So we're trying to get more people to be able to attend these public hearings. And I don't know if you want to say anything, Harvey, about what the House side is doing. So I'm the State Senate Commissioner, and Harvey is a State House Commissioner. So kind of the same role, but then a lot different too. So I'll let you talk about the House if you wish, Harvey.
Yeah, sure. Thank you. Our St. Louis meeting right now looks like it's going to be on October 21st. And I am awaiting location and times, and we'll send that out once it's all firmed up. There's going to be 6 meetings across the state. The St. Louis one is combining St. Charles, St. Louis City, and St. Louis County. So this would be your best opportunity to speak to the commission. If you want to produce a map, there's lots of good software that I can refer you to. If you want to just comment on other maps that may be posted, I will also forward where those maps are going to be posted prior to the meeting. And that's pretty much where we are right now. Unless there's any questions on that. Hearing no questions, are there any other folks either holding office or running for office who would like to say a few words? Okay.
Will the hearings be on Zoom?
Yes, they will. It's not clear at this point to me what the format is for citizens to participate in the meeting versus simply observing, but we did request, if it's technically possible, to have that happen. We'll have to see how that plays. But that's the intent.
Who asked that question?
Mark.
Okay, and the reason why I'm asking, I have some notes somewhere because we've had a couple meetings determining rules, and I just can't remember them right off the top of my head. But I'd be happy to go back and see what rules we passed for virtual testimony.
Well, or just virtual attendance. If somebody's interested in seeing how a public body works, maybe it would be nice if there was a way to do that without, wearing a mask and staying home like I am right now.
Yeah, okay. All the meetings so far have been archived on the oa.mo.gov site, and all the meetings in the future will be broadcast live for sure. I was thinking you were asking about participation over Zoom. That I'm waiting to. It's not clear to me. We asked for it. It's not clear to me that they're able to do that yet.
That would have been a great question had I asked it, so I'll take credit.
Okay. Okay. Are there any other announcements or folks that need to be acknowledged? Okay. Then I would like to do a quick poll. This is an anonymous poll. Just a quick question. I have Mark still on my screen. Is everyone seeing Mark, or has it changed?
Yeah, I can see him.
Now you came on the screen. Okay. For some reason, it doesn't want to put me on the screen when I talk. Okay. In any case, this is a very quick poll before our speaker, who is going to be talking about COVID. This is an anonymous poll. So no one knows who voted how, but the tallies will be shared with everyone immediately as the poll is taken. So you'll have, just about 30 or 40 seconds here, I think, because it's a real quick poll. And here it is. Do you think masks should be required in St. Louis County? And there's just yes, no, or not sure. Okay, so far we have 18 out of 21 people voting. I guess I'm not allowed to vote for some reason, as the host, I guess. Okay, 19 people have voted, and I guess our guest and me are the 20 and 21st. So I will share the poll results. And as you can see, this group feels pret's strongly that masks should be required.
I guess we know how everybody voted.
Yes, exactly. So that's a good point, and I will turn the meeting back over to Florence to introduce our speaker for the evening.
Good evening again, everyone. And I would like to thank our speaker, Mr. Broadus, for coming to speak with us tonight. I thought there was a need for our townships to hear about COVID, an update in St. Louis County. So I went on a rage to get someone to speak for us, and I was glad that he was able to come and speak to us. So I'm introducing Mr. Damon Broadus. He's the Division Director of Health Promotions and Public Health Research for St. Louis County Department of Public Health. He was born and raised in Kansas City, Kansas, received a BA and Master's of Science degree in Social Science at Pittsburgh State University in Pittsburgh, Kansas. His professional experience began in higher education administration. Before moving to St. Louis, Mr. Broadus worked in community development for Greater Kansas City as the program director of United Services Community Action Agency. Mr. Broadus has always been involved in community service. And I'm pretty sure you read his bio on the flyer that we sent out. It has more information on it as well. He's married to Belinda Broadus, and he has 3 daughters. And I'm going to leave it up to Mr. Broadus to name his daughters because they have beautiful names. And so right now, I'll turn it over to Mr. Broadus. Thank you.
Thank you. Good evening, everyone. Mrs. Pullen, I truly appreciate you for inviting me out tonight to share ever important information about the COVID-19 virus, and more specifically, what we're doing to increase vaccine participation rates. As the Division Director for Health Promotions and Public Health Research, I have program oversight for chronic disease epidemiology, which includes mental health. I have responsibility for health promotions, which really means community engagement and raising awareness around health education, whether it's nutrition, physical activity, chronic disease management, things like that. So our chronic disease epidemiology team collects the data and provides us with the analysis and produces profiles of the leading causes of death for St. Louis County. And then we in turn use that data to create programs where we reach the community, helping improve overall health and well-being across St. Louis County. My other work streams or portfolio that I'm responsible for includes substance use programming, which is the only statewide prescription drug monitoring program. And as I'm sure many of you on this call as elected officials know, we're moving to a statewide PDMP program. And so what we're trying to do is make sure we have the ideal best practice program, substance use program set up for the state of Missouri to inherit and administer, hopefully within the next 18 to 24 months. I also am responsible for assessment, evaluation, and policy. I have a staff that actually reviews those things and how it impacts us on the local level. They also work with our community health improvement plan. They're responsible for assessing our community health needs and working with hospital systems to make sure, we take a regional approach to overall community health improvement. And I want to thank you, Ms. Pullen, when you talk about personal pursuits and successes. I am most proud. I have 3 daughters who are all college graduates. The first one, her name is Kyrie Broadus, and Kyrie, we kind of changed the spelling of the name, because it means kingly or princely for a male, but we thought, having our first princess, we would name her appropriately Kyrie. And then my middle child, her name is Dominique. Actually, I should back up. My first child, Kyrie, she recently relocated to the St. Louis area just in the last 2 weeks. She wanted to be closer to her parents and the support system that's here. We have family. All my in-laws reside in the Metro East over in Illinois, O'Fallon and Shiloh area. And then my second daughter, Dominique Broadus, she's a basketball coach, women's basketball coach at University of Ozarks in Arkansas, Clarksville, Arkansas. She's been doing that for the past 2 years. She graduated out of Culver Stockton and was able to secure that coaching job in Clarksville, Arkansas. And she's been there for the past 2 years. And then last but not least is my youngest, who recently was hired by BJC Hospital. All of my kids, much like me, have been in community service, health services, public health in some shape, form, or fashion. But my youngest is actually a what do they call it? A consultant strategist for BJC Hospital. And that's a new role for her. She just graduated from SLU in May, and she started working for BJC in June. So we have fully transitioned and made our roots here in St. Louis, even though, I'm proud Kansas City Chiefs fan. I'm now a St. Louis Cardinals fan. And both have long legacies of winning, and we like to celebrate that as much as possible as a family and with friends. Tonight, hopefully I can share my screen, Mr. Harvey. Oh, okay.
It'll take me a second. I need to give you permission.
Okay. All right. Appreciate that. as he pulls that up, some of the things that we need to talk about is the impact that COVID-19 is having in some of our most disparate communities, and that is what I'm charged with. I've been with the St. Louis County Department of Public Health for the past 8 months, partly responsible for the COVID response and community outreach to those that we serve as a community health center. We're not a traditional federally qualified health center. We're considered a community health center because we have 3 clinics. And in late January, early February, Dr. Page St. Louis County Department of Public Health hired me, but Dr. Page appointed Rochelle Walton Gray as the COVID outreach specialist. So as part of that team, we're responsible for administering and providing outreach for a group called the North County Outreach Stakeholders Group. And it's a group of about, it's grown over the past 6 to 7 months, which we also have a group in South County as well, where we work with a group of leaders. Okay, I see the message. We work with a group of leaders to organize. We created an infrastructure to be able to not only provide education and information about the coronavirus in general, but specifically increase the vaccination rates. When the system was initially deployed initially, it was all online. So of course, everyone knows on this call that the digital divide is real. And so we had to work with a group of stakeholders to create an infrastructure where we could pre-register individuals to get access to the vaccine, which, at one point in time, we had participation rates as low as 2 to 3%. And now, as you'll see in this presentation, we're above almost 40% in some areas. It just depends which zip code. Can everyone see that? Okay, I'm sharing my screen. And this is just the first slide.
Yes, we got you.
Okay, great. All right, as I said, basically I'm going to go over our community engagement plan and provide a COVID-19 vaccine update. As I was saying, Dr. Sam Page created the North and South County outreach groups to overcome the inequities in both areas of North and South St. Louis County. And our goals are to increase, initially it was to increase pre-registration rates because the way the system was deployed, just a matter of fact, a lot of seniors and people that reside in North County do not have internet access. So that was the first hurdle for us to overcome. And so we worked with these group of leaders as well as residents to overcome the issues of access and providing accurate information. I'm sure everyone on this call is aware of all the misinformation and disinformation that is out there about COVID-19. And we've been dealing with that since late January and overcoming, hesitancy, which, it's duly warranted and noted of why those reasons. A lot of people don't trust government entities. They don't trust the healthcare system in general. And quite honestly, many don't have a relationship with healthcare providers. So, being intentional is one thing that the St. Louis County Department of Public Health has been in developing our vaccine, our equity approach to providing the vaccine. So we aim to provide a COVID-19 vaccine to every St. Louis County resident who wants it, while prioritizing at-risk and vulnerable populations and advancing equity. We're being intentional about increasing overall access to the vaccine. At this point in time, as you can see, as of September 16th, we've had over 1 million doses of the COVID-19 vaccine administered to St. Louis County residents. That's including those that have received their first dose as well as the second dose. An estimated 55 0.8% of St. Louis Countyans have received at least one vaccine dose at this time. And we're almost at the benchmark where we're reaching 50% of the St. Louis community have completed their vaccinations in their entirety. So that's either 2 doses of Pfizer and Moderna or 1 dose of Johnson & Johnson. And as of September 14th, we've administered on average 1,153 doses being administered each day within 3 of the health centers that we have, as well as what we call neighborhood pop-up events, which we've been hosting at least 15 to 16 events weekly since May of 2021. I have to also mention those doses that have been administered. That's more than twice the amount of any other county. And as a county, we're ranked 3rd in the state of Missouri for vaccine administration, and 3rd is behind both Boone County and Joplin. And just last week alone, like I said, we typically have hosted 15 events per week. Last week alone, we administered over 12,000 doses of the COVID vaccine. Next slide. This slide kind of speaks to the poll that was just taken. When you talk about, I say speaks to, because it indicates the importance. It indicates the thresholds for transmissibility. This is a brand new metric that we've included in our weekly reports that we get from Show Me Vax, the data. I'm sorry.
Damon, if I can interrupt you just for a moment.
Yes, sir.
It's Harvey.
Yes.
Maybe it would be easier if you could make that full screen. There's a little button down on the bottom there.
Can you see it? Did it make it?
Oh, I see. It's got the notes.
Yeah, I have to turn that off. Hold on just a second.
It's a little bit of an eye chart, the size it is.
Let's duplicate. There you go. Can you see that okay?
Oh, much better. Thank you.
All right. All right. As I was saying, this speaks to the poll and why it's important for us to pursue masking orders. And this just speaks to the threshold for transmissibility. As you can see, we have an average of 174.9 persons per 100,000 that have tested positive for COVID-19. In the what do we call it? The graph below the metric up top, that just kind of highlights how we have over 100 new cases per 100,000 7 days, over the last 7 days per 100,000 individuals. And then we have more than 145 new cases per day over the last 7 days, 7-day average. And then the trend in new cases, we're now at 9.4. Last week we were at 9.2%, but that's still a decrease in new cases. That's not saying we're through the woods yet. That's just saying over the last week we've had a decrease in new cases, a slight decrease in new cases. And then we look at the test positivity rate. I'm sorry, that I said earlier, 9.2%. That is our current test positivity rate, and that anywhere between 8 to 10% gets us at a substantial risk. So as you see the bolded boxes, those are the areas for causes of concern, because it has to be recognized that the Delta variant is dangerous and more contagious than smallpox. Every person infected with Delta, with the Delta variant, spreads the virus to an average of between 5 to 9 people. And so for comparison, every person infected with the original COVID virus, it came out in 2020, the virus spread to an average of between 1 and 3 people. So we're seeing a larger increase in transmissibility just because of, not just because, but due to the Delta variant. And St. Louis County last experienced this kind of incidence rate in early February of 2021, when we were still coming out of the winter surge and before vaccines were largely available. And so the last week, as you can see, the 7-day average, well, at one point in time, the 7-day average was over 200. And I want to say that was early August. And now we're at 174.9 per 100,000 for nearing a 7-day average. So again, while it's somewhat lower of transmission, that does not speak to, not having a need to be vaccinated and wear a mask or follow all of the behaviors that have been recommended by the CDC. Wow, I see someone in the box in the chat box asks which counties have a higher vaccination rate than St. Louis. Greene County, I believe at this time, still has a higher vaccination rate. That's a great question. I can't remember the other counties. I'm sorry, but I know Greene County was one of the first to share their vaccination rates, outside of just keeping it internal to their organization. How are new cases identified? New cases are identified through testing. We operate a testing center, and just anecdotally, I can share, today I know 43 people were reported as testing positive for COVID. For the last few weeks, a number of those have been youth, anywhere between 12 to 18 years of age. The higher percentage of youth have tested positive, but I get, and nurses sharing that information with me anecdotally, almost weekly, sometimes daily, because at one point in time we were seeing at least 100 cases every 2 days. And it was just startling. Did you say Boone County was the other higher vax rate? Yes, Boone County and Joplin have a higher vaccination rate than St. Louis County. We rank third to those two. I can't answer that question, Brenda, as far as what is the death rate, especially among those under 40. Well, I may have a report that shows that. I would have to pull that up. We have that information, and I can share that information with Ms. Pullen after this call, and that way you can take a closer look and get a better idea of our performance, our vaccine performance across the county as a whole. Again, we are providing vaccine appointments through a variety of ways, most notably through our permanent clinics, our brick and mortar clinics at John C. Murphy in Berkeley, which is where I'm housed. Our correction medicine staff, they're providing vaccines at their clinic, as well as South County and North Central off of Jennings Station Road. And then we have a partnership with our local EMS and first responders, and they are providing services to the homebound, as well as standing up some of our other neighborhood pop-up events. And then most recently, I don't know if everyone saw Dr. Page's update today, but this week, the St. Louis County Library and DPH will begin offering COVID-19 clinics at 4 library branches through the end of 2021. We've been looking at things on a quarterly basis, weekly and quarterly basis. We've been adjusting our strategies about every 2 weeks based on the needs of the community. And so this partnership with the St. Louis County Library has allowed us to expand the partnership between the library system and St. Louis County. The weekly clinics will provide a reliable and consistent schedule, making it easier for people to get a vaccine while they're visiting the library. So some of those library vaccine clinic schedule include, it's on Wednesdays at Lewis and Clark branch, Thursdays at the Natural Bridge branch, Fridays at the Florissant Valley branch, and Saturdays at the Rock Road branch. This partnership or expanded partnership provides greater access to the vaccine and helps eliminate the disparities in certain zip codes. We have a very targeted approach when I talk about our vaccine health, vaccine equity efforts. We have a very pronounced opportunity or strategy in North County. Getting more of St. Louis County vaccinated is critical to getting the community through the pandemic, and that's what we've been focused on. At those branches that I mentioned, at those clinic branches that I mentioned, appointments can be made, but walk-ins are welcome in between the hours. All of them have varied hours. On the weekends, it goes from 9 to 4 p.m. And then throughout the week, it's 1 p.m. to 7 p.m. Let me check this chat box really quickly before I move to the next. Yes, thank you for posting the COVID vaccine. Mo Stops COVID is an easy way to remember the statewide system. We do administer and provide regular updates to Show Me Vax via that website that is in the chat box. Are there any estimates of cases that in people who do not get tested? Unfortunately, we don't follow that metric, Harvey. All right. Okay, there it is. Again, this is just an overview of what I shared earlier and how we're relying on the state for vaccine supply. We're positioned to educate the community on the importance of getting vaccinated and engaging the community and how we can better serve St. Louis County. We, as I said earlier, we rely heavily on our partnerships, and they speak with a trustworthy message. We partner with those who are credible in the community. For example, I don't know if any of you have been on the Revive STL website, but if you go there, you will see Mr. John Bowman, who has a blog post as well as a video post where he talks about the importance of getting vaccinated. We work with our faith-based organizations as well as barber and beauty shops to communicate the importance of getting vaccinated. And that's part of our regular vaccine partnerships. And so to increase that vaccine access, we're focusing on smaller events at community organizations, like I said, churches, businesses, and labor unions. We have a partnership with, or started a partnership with Sal Valadez, who is a strong proponent in a strong recognized leader in the Latinx community. And so he's doing some messaging as well. Again, we work closely with others to just bolster the response to the COVID-19, focusing on vaccine acceptance and delivery, overcoming the hesitancy that I know everyone's heard so much about. And again, this is slide just highlights our coalition of over 35 community groups who are collaborating and communicating. They actually are working with us to host vaccine events. Again, I mentioned the library. That's an example. We've partnered with other groups. The Urban League is another group who has helped us put the information out. Again, overcoming the internet or lack of internet access. And then we've built a infrastructure offering people of color, immigrant communities, and people with functional needs and other community partners regular access. They use a lot of the information that we provide on Revive STL, and they share that. I was just looking at the chat box to see if there's anything I hadn't addressed just yet. Thank you for that post. And again, this slide just highlights the variety of activity that we have been pursuing over the last 8 months. Again, just increasing awareness through regular communication. We have other opportunities, other campaigns that we've developed. We have a campaign called Sleeves Up STL, which is a vaccination initiative where we partner with over 50 North County beauty salons and barbershops to deliver our messaging and provide accurate information, not only accurate vaccine information, but asking them to host actual events in their barbershops. And we are part of the national initiative, Shots at the Shop initiative, where we provide materials for shop owners so that they can use that to talk to their clients about being vaccinated. And again, working with the Urban League, they recently donated or have been donating thousands of masks. They actually received 10 million masks as part of a donation. And we're part of that outreach effort where the barbershops and beauty salons are using those masks because they're seen as trusted messengers in the community. So that we're just leveraging every type of opportunity we can to provide information to the community in every aspect, in every setting, reaching people where they live, work, play, and pray. What is the magnitude of the disparity between race, zip code, class, and other demographics? Does that differ for St. Louis and other areas? I could say honestly, initially in February, like I said, we had participation rates that are vaccine participation rates that were less than 2% in many of the areas. And I have a slide where you'll see it's increased over the last 6 to 7 months, and that is again because of the infrastructure that we've created. And how does one make an appointment for the homebound? There's a phone number that I can provide to you toward the end of this presentation. It's 314-615-2660. That is the number for making an appointment for the homebound. 314-615-2660. Sorry. Again, we've convened meetings, we've built trust. Like everything, you have to have a relationship with those that you are working with, those that you are serving, those that you want to improve either awareness or education. So we built trust through regular town hall meetings, sharing facts and working with medical experts. We have infectious disease experts that are employed through the Department of Public Health, as well as we've relied on partners from Mound City Medical Forum, which is the local chapter of the National Medical Association, providing information on a regular basis. Because one thing we heard from all the different partners I've talked about, whether they're from the Urban League, whether they're from barbershops, whether they're from churches, they wanted to hear from professionals, healthcare professionals that look like them. And so we made sure we engaged Mound City Medical Forum. Dr. Monique Williams is a strong advocate for healthcare access and information, vaccine information. So she provides that almost weekly, if not bi-weekly. And then we partner with other groups at BJC, Show Me Hope, which is a mental health, behavioral health network provider. They deal with other what we call social determinants of health, dealing with housing, employment, utility assistance, mental health, whatever other things that we may not have in our toolbox at the Department of Public Health. And then we have a strong partnership with Faith and Forsake of All when it comes to a more religious or spiritual approach. And then we've done a number of different events. I haven't updated this slide probably since March, because like I said earlier, we've pivoted about every 2 weeks and we've responded to whatever the needs may be in the community. And right now, the greatest need we know is around COVID testing. And we do provide COVID tests to the public via our 2 clinics or at pop-up testing events. You can, again, consult our website, Revive STL, to get the latest and greatest on everything COVID related. And then this is just a slide highlighting some of our partnerships. As I said, we have partners that are recognized as leaders through the immigrant communities, through, whether that's Nintendo for Africa, the Hispanic Leaders Group, the NAACP, the Black Nurses Association. They've hosted a number of town halls, digital town halls for us. We've partnered with other small grassroots organizations, the Red Circle, Legal Services of Eastern Missouri. They actually hosted our first outside town hall, where again, we had medical providers available, we had service providers available, providing as much information as we could around the COVID-19 vaccine. And then, you see a number of our other organizations that have been involved. And I somehow kind of got off my presentation cadence. Hold on just a second. All right. Someone asked a question earlier about the disparities. This kind of shows the vaccination gaps in 12 of our zip codes in the county with the highest number of unvaccinated individuals. We probably started tracking, I'll say, lower vaccination rates probably early to mid-July, and we identified 12 zip codes with the highest number of unvaccinated individuals. And we looked at, census data and the Show Me Vax records to identify. You see in the most northern zip codes in the most northern counties are highlighted there, as well as in the southern portions of the county highlighted in yellow. The northern cluster, shows that 32% were partially vaccinated. Again, this was in July, so that was actually a total of 114,000 unvaccinated individuals. And then in the southern cluster, we had 142,000 unvaccinated individuals. For whatever reason, hesitancy, misinformation, disinformation, or just overall, like I said earlier, no relationship with a healthcare provider whatsoever. And so that has created this enormous disparity. And then just analysis focusing on the northern cluster due to its population density and poor vaccination performance. That's what's driving our efforts that I highlighted earlier in this presentation. Again, this slide just kind of reiterates what I shared around our faith-based initiative, which is just a collaborative effort made up of at least 20 churches in North County. We partnered with the Urban League and their Grills to Glory program to encourage advocacy and vaccine administration in the underserved and vulnerable communities. And then we have a segment we call Medical Moments, where again, we have medical professionals in concert with faith leaders that provide an opportunity to share with their congregation vital information. So they do weekly video snippets during Bible study or doing other opportunities that the churches identify for us to be able to communicate the importance of getting vaccinated. So inserts in church bulletins and things like that is what our faith-based initiative is targeted. And it's segment called Medical Moments. This is the results to date of our efforts to overcome vaccine inequities. As you can see, the map indicates changes in vaccination percentages from June 25th, which is when we initially started tracking. As I said earlier, we identified those 12 zip codes in certain clusters. And again, now you see double-digit vaccination rates, whereas, if I went back 5 weeks, you'd see single-digit increases in those 6 zip codes that are highlighted. So we have targeted efforts in 63133, 34, 35, 36, 37, and 38, where we're hosting pop-up events. We're hosting community events, at the health centers. Like we had a back-to-school fair back towards the end of August, which was very successful. And that also led to the largest increase in 63140, which is where John C. Murphy is located. As you can see, we're up to a participation rate of 14.7% in the last 11 weeks. So, we actually, as I said earlier, get weekly updates. We have a data analyst that provides us with this information. That slide back on slide 2, that was the most recent piece of data visualization that we have started receiving around transmissibility. And again, it speaks to or it informs our decisions of what we need to be doing next. So that this is strategically how we're trying to overcome the disparities that exist across St. Louis County and working in partnership with a number of different groups. I know I've shared a lot of information and went kind of fast. I wanted to respect everyone's time, but please don't hesitate to go to our COVID-19 Information Center, which is stlcorona.com. I'm sure everyone is aware of this website, but most recently, we launched, August, we launched Revive STL, which is more, I'll say, a marketing. It's, using algorithms to target, specific people and how important it is to get COVID-related information that is important to you. And what I mean specifically is, if I go to Revive STL, I pull it up, it pulls up constituents that look like me. If you're Hispanic or white, based on your zip code, you pull up information. The information is marketed for populations that look like you. And it has been shown, yes, it has been shown that is effective in reaching communities and people exactly where they are. And that is the essence of public health, reaching people exactly where they are, providing culturally relevant information. And that is what we intend to do going forward with all of our other efforts. We still provide regular vaccinations. I'm sorry I can't answer the comment that was made earlier about the battery of vaccinations that you should receive. I can put you in touch with our chief medical officer or some of our other providers at the Department of Public Health, and they can speak to those medical related questions. I make it clear, I am not a medical professional. I just am able to communicate the information in a relevant way. How does City of St. Louis compare to St. Louis County? We have a strong partnership with the City of St. Louis. We are partners, like I said earlier, in our community health improvement plan, taking the regional approach to addressing health inequities and health disparities. We have a comprehensive approach to that. I can honestly share that, based on resources and the infrastructure we've built, we have been outperforming the City of St. Louis when it comes to vaccination rates. We have a partnership, both us, the City of St. Louis, and the county, where we partner with researchers at Washington University on a project called Community Engagement Alliance. And they've been highly interested in pursuing some of the strategies that we have here in the county. And quite honestly, they just don't have the capacity that we do when it comes to being able to reach the community in the same way, hosting vaccine events weekly, regular communications, canvassing neighborhoods. I'm not saying they're not doing those things. They just have a smaller staff than we do, and their ability is less than the St. Louis counties. Has DPH reached out to the teachers union about vaccines? I know that we have a constituent services department that works with all the businesses in the region, as well as the teachers unions. They have a number of youth sports advocacy organizations that are engaged. And again, those are the sorts of things, the teachers union, those are the sorts of things that feed us information on our strategy and how best to reach the community. How about St. Charles? They seem to be reluctant to put regulations in place. Totally agree, Harvey. That's why I asked, someone made a comment earlier about tonight's meeting, I don't know if everyone heard me. I wondered if they were meeting without mask on, without the mask mandate. And that's been so politicized. I try and avoid that conversation, but I know, Dr. Page and our leadership at DPH, has pursued mask mandates, mask orders. Everyone on this call I'm sure, is truly aware that 2 weeks ago, the St. Louis County Court considered the impact of a council vote on the public health order calling for masks to be worn indoors. I know that's being revisited. I was in a leadership meeting earlier today, and we know that the court has yet to issue its final ruling, but once that decision is rendered, we're looking at, with consultation with the county council, how do we proceed with an updated mask order? But other counties, they're a lot less reluctant, or for whatever reason, to deal and make appropriate decisions that benefit the public health for all. With that, I'll close my presentation and open the floor for any other questions that may be out there. Harvey, thank you.
Mr. Broadus, I have a question about testing, if you don't mind.
Yes, ma'am.
So it seems like I hear people saying, they're having a hard time finding a place to get tested. But my understanding from visiting Revive STL is that they take walk-in testing at the health centers, or you can even drive through. Is that correct? So if I wanted to go get a test, okay. So if I wanted to go get a test tomorrow, I could just drive to the health department and get tested.
Yes, ma'am. You can pull up, and it would take a little while for you to get your results. I don't know the exact timeline, but I co-locate with the office that contacts individuals to give them the results of their test, and people are pulling up daily. Like I said earlier, we had 43 that were reported that tested positive today.
Okay, and so my next question was, when would you get the results? But you don't have the answer to that question.
Yes, because I know, due to supplies, due to communication channels, I don't know the exact timeline for when reports are given. So I don't want to.
Okay, and also I'm jumping in here for Sydney. She's my daughter. She asked a question in the chat about why doesn't the county test children under 2? Do you know the answer to that?
Under 2?
Correct. Under the age of 2.
Yeah, no, I don't know the answer to that. That would be medical related, and that's not my expertise.
Okay. Thank you very much.
Great question, though. Great question. I will take that back to our medical experts and ask that question.
Okay. Thank you. This was a wonderful presentation. Thank you so much.
I appreciate it. Thank you. I appreciate the sentiments.
Are there any other questions? Well, hearing none, first, thank you. And go ahead.
Is testing less available in the county or in general? I ask that only because I didn't have any problem getting tested after a trip mid-August. But I'm hearing from others that are trying to schedule at Walgreens, for instance, and not being able to, or having difficulty with that.
I know 2 weeks ago, it was more about supplies, supply chain, all those sorts of things. But at this point in time, I think it's more the staffing shortage and the capacity of any one organization. Even our organization was challenged at one time to provide testing. But again, we pivoted, everybody knows about the pivot, but we pivoted and have been able to meet the needs for testing. So we have the supplies. We now have the capacity to provide it regularly. And like I said, we're providing it at each of our health centers. So it was a major issue about 2 weeks ago, but every week it has been a reason why it was a challenge.
Thank you.
And honestly, it just depends on the environment. Like you said, if you went to an urgent care center, yeah, I heard they were even charging higher rates because of the shortage of supplies. I don't know if there's any truth to that, but that is something that I know, was impacting everyone 2 weeks ago.
If
But the
everyone will stay
testing
around
is-
for a minute, I'm working on one more poll while we take the last few questions.
The testing is no charge at the county, though, correct?
Correct. All testing is free.
Thank you.
Well, this is Florence Pullen again, Mr. Browners. Thank you so much for an interesting discussion this evening on COVID-19. I really appreciate all of the good information you gave us. And I'll be getting back in touch with you for other talks, hopefully. Thank you.
Thank you, Ms. Pullen, for the invite and the perseverance in getting a hold of me. I know it was a challenge, just due to volume of emails, volume of calls, things like that. So because of your perseverance, I was able to make it tonight. I appreciate your sentiments, Ms. McCreary. And then one last thing, I know we talked about, free testing. We talked about the number 314-615-2660 for scheduling homebound appointments. That number is also available where you can anyone can arrange free transportation to and from COVID-19 vaccinations. You call that number. We have a service provider because we know transportation is a barrier as well, but they will provide transportation to and from a vaccination appointment free of charge. So again, that phone number is 314-615-2660. And I have to share, rides must be scheduled by 5 p.m. the day before and can be scheduled up to 1 week in advance. So if you know anyone that needs transportation assistance, please have them call 314-615-2660.
Excellent. Thank you. I do have one more poll. This one's a little bit more controversial, and Damon, no one expects you to comment on this one. I'll go ahead and put it up. Please ignore the second question. I'm still learning how to do these things. So here's the poll. Do you think proof of vaccination should be required to enter public spaces like restaurants and sports events? Yes, no, not sure, or I don't care because I'm not going to go to these things until COVID is over. So if you guys will take a minute, it's an anonymous poll. And we're seeing the results coming in.
You do have to answer the second question in order to submit your answer.
Yeah.
Oh, my apologies. Thank you for letting us
I just put
know.
choice one. Yeah.
You do have to answer the second question in order to have the poll registered.
Yeah, I just selected choice one.
Okay, we have 12 people so far. Anyone else? 14 still coming in? I feel like an auctioneer here. I got 14, 15. I have 15. Doris, 15. Okay, well, just a couple more seconds here in case there's anyone else trying to figure it out. Okay, once again, this audience feels pretty strongly.
Well, these are my people. These are my people.
Yep. Okay, well, Damon, I know politically that'll probably never go over, but in case that's of value to you.
Those of us at DPH will love those statistics. So I'll make sure I share that with our leadership and how supportive this group is of our efforts. So thank you again.
Thank you. Thank you.
Thank you. And Florence, is anything else you want to bring up? Otherwise, we'll conclude the meeting.
No, I'm just happy that we were able to have this discussion and look forward to other meetings as inviting. Thank you.